Hello, and welcome to our listeners around the world. This is the JAMA Editor's Summary, and today is Friday, February 7th, 2025. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. I'm joined today by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. This week, JAMA published a research article by Dr. Hanlon and colleagues that evaluated differences in type 2 diabetes treatment by age and sex. It specifically looked at sodium glucose cotransporter 2, or SGLT2 inhibitors, glucagon-like peptide 1, or GLP-1 receptor agonists, and dipeptidyl peptidase 4, DPP4 inhibitors. The authors conducted a systematic review and meta-analysis that included 601 trials from U.S. and Chinese clinical trial registries to see how hemoglobin A1C and major adverse cardiovascular events changed with medication, age, and sex. One of the major findings in this article was for the SGLT2 inhibitors. For this class of medications, the authors report a greater reduction in the risk of major adverse cardiovascular events when comparing older and younger participants on SGLT2 inhibitors, despite smaller reductions in hemoglobin A1C.
Yeah, it's very interesting finding. The authors indicate that these results emphasize the importance of considering cardiovascular effects when choosing a diabetes medication for older patients. JAMA also published a research article by Dr. Pose and colleagues evaluating the addition of Simvastatin to Rifaximin for patients with decompensated liver cirrhosis. Rifaximin is already used to reduce the risk of hepatic encephalopathy recurrence in this population. This is a double-blind, placebo-controlled phase 3 trial in which 237 participants were randomly assigned to receive rifaximin plus simvastatin or placebo, in addition to standard therapy. The authors assessed the incidence of severe complications of cirrhosis associated with organ failure and conclude that simvastatin plus rifaximin did not prevent severe complications of liver cirrhosis in this population.
JAMA also published 2 research letters this week. The first research letter by Dr. Kai and colleagues is a cross-sectional analysis that highlights the challenges of using an older drug for new indications. This is especially important when new formulations of a drug become available at the time new indications are approved. Clinicians can choose to prescribe new, approved formulations or existing off-label formulations with similar dosing. Doxepin is a tricyclic antidepressant that is now a recommended first-line treatment for insomnia. The authors evaluated Doxepin prescription fills, retail spending, and prices from 2019 to 2023. They included data about generic and brand-name low-dose Doxepin tablets specifically approved for insomnia. They also included data about similar doses of capsules and liquid Doxepin that are used off-label to treat insomnia. The authors concluded that the new low-dose formulation tablets had higher prices and fewer 30-day prescriptions compared with the original off-label formulations.
The other research letter by Dr. Castrillo and colleagues is about BTMPS, a substance used as an adhesive or sealant in plastics manufacturing. These authors were interested in how often this substance occurs in illicit fentanyl use in the U.S. Animal studies of BTMPS document adverse health effects like cardiotoxicity and sudden death. In this study, the investigators tested 284 illicit fentanyl drug samples from 9 community-based programs across the U.S. that examined these drugs. 35% of these samples contained BTMPS. And the authors report that the amount of BTMPS in available samples typically exceeded the amount of fentanyl, sometimes by orders of magnitude.
JAMA also published 3 viewpoints this week. Dr. Kleinman and Barnett describe how Medicare Part D does not cover over-the-counter naloxone costs for beneficiaries. They use the parallel example of nicotine replacement therapy to demonstrate the importance of working toward Medicare Part D coverage for both over-the-counter naloxone and nicotine replacement therapies. Dr. Ogolia and colleagues discuss how residency programs could successfully integrate objective metrics like test scores, grades, and research experience during the application process.
And we have a viewpoint from Dr. Edwards, who provides her perspective on the safety and efficacy of pediatric vaccinations. Her timely viewpoint notes that since 1974, routine pediatric vaccinations have averted 154 million deaths, including 101 million infant deaths, accounting for 40% of the observed decline in global infant mortality.
There's also more content this week for JAMA Clinical Reviews in Education. Dr. Pandya and colleagues explain guidelines released by the American Thoracic Society about pulmonary rehabilitation for adults. The guidelines recommend pulmonary rehabilitation for stable COPD and interstitial lung disease, as well as for pulmonary hypertension. The article links to a video that reviews proper use of inhalant medications for chronic respiratory diseases. Tune into the JAMA Clinical Reviews podcast for further discussion about these guidelines with the guideline synopsis contributing author, Dr. Michaela Restivo-Anderson. Here's a clip from the podcast that contextualizes why it might be difficult to find rehabilitation programs.
About 25% of patients who are candidates for cardiac rehabilitation actually participate in cardiac rehabilitation. That number is only 5% of patients with COPD who are participating in pulmonary rehab. So we are significantly underutilizing this really important resource. We have to think a little bit about what these programs are, and then that helps us understand why access may be limited. So these programs are generally occurring in a hospital, very rarely in a physician's office. They are not going to take place in freestanding physical therapy or these privately owned physical therapy offices. And that gets back to what we talked a little bit about before, which is that it's a multidisciplinary intervention. So it requires not only physical therapists, but also respiratory therapists, nurses, dietitians, and a medical provider on site. So it can be difficult to find these programs.
The JAMA Long Review this week is by Dr. Singla and colleagues, who explain the pathophysiology, clinical presentation, diagnosis, and treatment of testicular germ cell tumors. There's also a JAMA Insights by Dr. Albury and colleagues about how to communicate with patients about weight loss. The patient page this week is about pericarditis. The patient page explains what the condition is and the treatment approach for both acute and recurrent cases.
In JAMA Medical News, there's a JAMA Plus AI interview with Dr. James from the University of Michigan on digital health technology. Dr. Perlis, along with Kate Schweitzer, write about Dr. Perlis' interview with Dr. James. Let's listen to a bit of their conversation.
One of the things that I've gotten into the habit of, and this is older or younger adults, is do you use the portal, right? It's key for me not to assume that a person does or does not use the portal. In our electronic health record, I can look in there and I can determine whether or not a person is signed up to use the portal. But asking whether or not a person is interested in using it, if they've used it, and then from there determining whether or not, because maybe they're interested in using it, but they just don't know how. But trying to ensure that we have people that are in place, and we do have people that are very comfortable with assisting our patients with getting set up with the portal, but ensuring that we have that opportunity to do that. And I know that that's not the case for everyone, and that we have people that can kind of help patients to get set up with the portal. But I think the biggest thing is not assuming, but instead asking a question, regardless of age or any other demographic, but asking whether or not there's an interest. And if there is an interest, what's the next step from there? Do you feel comfortable using it independently? And if not, what can we do to help you with that?
There's also a piece on the Surgeon General's recent advisory on the causal relationship between alcohol and cancer. Lead senior staff writer Rita Rubin talks about other countries with alcohol advisories and effective warning labels. Freelance journalist Anna Bach wrote an article about the Voices of Black Women study. This is a landmark study by the American Cancer Society, which hopes to better understand cancer risks and outcomes among Black women.
Thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.